Good morning. This is Dr. Timothy Scott Beck coming to you from LifePoint Medical, and it is September the 2nd, 2020. And I want to say good morning to you and let you know that we are getting ready in the next 20 minutes to open the clinic up. It's almost 8 o'clock, and we're going to be listening for your phone call or your call if you need some help. And like I explained yesterday, getting to your medical conditions quickly is a very valuable thing, I think, to the community and to my patients, and it helps me prevent you from getting more advanced diseases, and it saves time, money, lives, the whole 9 yards. So if you have a problem, I want you to call and come in here and see us and let us try to fix it for you before it gets out of hand. As far as what's going on with the COVID-19, there's 283 cases, and then there's an additional death that they reported overnight. I don't know who that was. However, I do know that we've had patients where we've trying to help them manage their COVID-19 infection, and we're trying to do it very safely. In other words, they don't come in the office. We do telemedicine with them, and if they need confirmation or need some blood drawn or need help, they meet us in the parking lot, and we try to go out there and give them good advice. Okay, and honestly, if you think you've got COVID-19, you call us and talk to us about what's going on and try to be forthright with us, and then we'll try to manage it so that we can get you some help without endangering our staff or anybody unnecessarily. So just let us know. It's going around. That's 5 more, I think, than what happened yesterday. So please be careful. We've been doing this so long now. I know people are complacent with some of the things that we have in place. Okay, but I think now it's more about perseverance till we can get ourselves in a better place locally and nationally when it comes to this thing. I will say that it appears that the mortality rate, the death rate, has dropped significantly, but it hasn't gone to zero. Okay, so it's still a concern, and I pray that every morning that we can get through this without any unnecessary pain, suffering, or death. Okay, so let's keep our eye on the ball there. I do want to talk to a couple things. We are accepting new patients here in the office. If you got friends or family that need a doctor, the most sincere form of advertising, everything is word of mouth. Okay, and I appreciate it when people do that, because I think it helps me and the patient out. Okay, because I think when people hear, hey, I go see this guy and they treated me good, the patient comes in with a more positive attitude, and we have, I think, a more positive attitude about things going on, and that's beneficial to everybody. Okay, because our job is really to take care of people and to look after them and address their needs and help them. And when the patient comes in on board with the situation, man, it's a lot easier, and it's actually enjoyable. And I love some of the relationships that I have with patients, and my whole staff here. We really genuinely do love people. We like to see them come, and we try to help them. And the only thing we can't do is we can't do things that are illegal. Like give people meds that are inappropriate, or if somebody is just disgruntled with us or nasty with us, we have to mediate that, and it does happen occasionally, but it's nothing personal. I don't think. It's just the way life is sometimes. Nobody gets along with anybody, but if you know of somebody that wants a new doctor, we're here for you, and we're going to try to help you. Okay, I do want to remind everybody that we've got the weekend hours. Several patients have come in and didn't know about it, and I don't know if this video gets to everybody. I'm pretty sure it doesn't. But if you have friends or family, that you can let them know that we're open here on the weekends, and we'll try to accommodate them 7 days a week. Matter of fact, the only time we're going to be closed is Labor Day, and we will close on the day of any kind of holiday. Okay, the very day that holiday occurs is when we're going to close. Okay, the women's clinic is up and going. If you do Facebook, if you'll find the women's clinic Facebook page and follow it, that would be helpful. That'll keep you in the loop with what's going on over there. And Monique is doing a great job, and we're getting positive feedback from folks, and we appreciate everyone giving her and us a chance to help with their medical care. Thank you. It's great. One thing I want to talk about, a little clinical pearl this morning, I'm going to keep it quick. That's urinary tract infections. The reason I want to bring up urinary tract infections is because there's a few things about those that I think we need that would clarify. I'd take care of UTIs almost daily. Somebody comes in with a urinary tract infection. In other words, they got an infection in their urine. So there's some things. First of all, when you detect or you sense that you're having a urinary tract infection, the most important thing you can do is seek help, okay? Waiting on these can a lot of times end in you getting it spread to your bloodstream. So I think prompt being seen is a good thing. I think immediately when you say I got a UTI and you start trying to get seen, you need to start drinking water, okay, because you need to hydrate yourself. And you hydrate yourself till your urine turns clear, okay, and that's half the battle when it comes to UTIs, urinary tract infections. Then you're going to look for us. The thing I don't want you to do is I don't want you to take some of these symptom numbing medicines. They like azo. Those scare me because if you got a UTI, I don't want you to mask the symptoms. I want you to get treatment. Okay. Now sometimes they go away spontaneously, but a lot of times they don't. And the thing that scares me about the azo and the things that actually just cover up the symptoms is I think it makes you more prone to it spreading into your bloodstream. Okay, because you're masking your body saying, hey, something's going awry here. So if you have a UTI, you think you've got a urinary tract infection, and most people know, particularly women know when they got one or they got one coming, you need to call us and start getting to be seen. And like I said, we're open 7 days a week, so you'll be able to be seen promptly, and we'll evaluate you and give you antibiotics. But I want you immediately when you realize that you've got a UTI, you start hydrate, okay, because hydration helps, even if it does spread to your bloodstream, it helps you to be more stable with the situation and not become unnecessarily sick. Okay, this is Dr. Timothy Scott Beck coming to you from LifePoint Medical. We'd love to see you if you're sick. We've got a great team here and we're working hard every day to serve you and this community. Have a great day.